Great. Thanks so much. Um, so my name is Andrew Paris, and together with my colleague Pete Grayshock, we will be sharing with you the Mid-Air People in Need survey that we created and have run a couple years now to better understand from the people whom we're serving how they feel we are doing according to the CHS as well as our own values. So let's go to the next slide, please. So what it is, very briefly, it's an annual survey of people in need to find out how they feel we're doing and why they've given us that rating. And also we're asking them, how can we do better? It is structured around the CHS as well as our Mid-Air values. Next. So just you all know what the CHS is, so I won't go over that, but I'll share just briefly our values. They are the words in bold and gold. And it is this: we are driven by faith and strengthened by joy, which moves us to compassion, which gives people hope because we treat people with dignity as we practice accountability with integrity. So those are our 7 values: faith, joy, compassion, hope, dignity, accountability, and integrity. And as you can see, they are very closely aligned with the core humanitarian standard. Next. So why do we do it? Why have we created and why do we run this survey? Very simply, it's to hold ourselves accountable to those who we serve, to know how we're doing, to learn how we can do better, basically to improve what we do and how we do it and the impact that we can have. Another kind of side goal of the survey is to promote understanding and adoption of the CHS and our values in all that we do. By asking these questions and addressing what we find, we're also seeing that it forces to some extent us and all of our staff to better understand what the CHS is and our values and how we're living them out. Next. So get into the technicalities of it, we are using an ONA or ODK survey. We'll have an enumerator, which can be a Mid-Air person or not, who introduces the survey, talks about data protection, talks about confidentiality, and gets people's permission to conduct the survey, and then collects a handful of preliminary information about the respondents, which base they are in the country, what types of sectors they're getting help in, are they male or female, and 1 or 2 other things like that. And then basically the enumerator reads these 24 different statements that all address one of the CHS commitments or our values. And then the enumerator will ask the person or group that they're interviewing, how strongly do you agree with this statement? You can see that's a little screenshot from my telephone. So in this case, the statement would be Mid-Air looks for the most vulnerable, such as people living with disabilities, and adapts in order to meet their needs. And then we ask the person, how much do you agree with the statement, from strongly disagree to strongly agree. There may be some questions that people don't really know or aren't qualified or don't feel that they have enough information about Mid-Air, about how we work in order to answer it. And for that reason, we've put a don't know on the far right-hand side. And then we're always asking people, why did you give us this rating? What is your experience that has informed your rating, and then how can Mid-Air do better? Next. Just the brief history. In 2019, we conducted the survey in the 3 countries of Nepal, Jordan, and Somalia. In 2020, we took a break. And last year, DR Congo, Jordan, Lebanon, Madagascar, and Somalia participated in the survey. And this year, we've conducted the survey recently completed in Afghanistan, South Sudan, and Yemen. Our goal is to have every country do it every other year. We're not quite there yet, but this is sometimes countries have various challenges. They're not able to run the survey in, but this is where we're at for this year. Next. So we ask for the countries to do at least 100 surveys of people in need, ideally over 30 surveys each in 3 different locations, so we have some statistical significance. 30 is often a good minimum number for something like that, from different locations. And we also have the availability to conduct the survey as a key informed interview, exit interview, household visit, phone, or focus group discussion. And when we're doing a focus group discussion, then we're actually counting the number of yes, the number of strongly agree or strongly disagree or agree, etc. We're actually counting the number of those and entering those in so we have like an individual, every individual's vote is counted. And ideally, it doesn't always work this way, but ideally we're also suggesting that people conduct these surveys as an alternative to normal surveys. So if we normally have focus group discussions or normal exit interviews, maybe for a month we could substitute this survey once a year. Next. So to again to get into the detail of the survey design, we read people the statement. In this case, MEDA responds to the most urgent needs of your community, and you can see that's correlated very strongly with the commitment 1. And then we ask people how much do you agree with this? And if we're doing it in a face-to-face, we might even offer these smiley or unhappy faces to give the people an indication of what each of these levels means. So these are all positive statements. So higher is always going to be better. Then we ask again, why do you give us these ratings? What did you experience, or what have you heard, and how can we do better? And as I noted, during focus group discussions, we're asking the facilitator, the enumerator, to take notes during the discussion before the rating happens, and then we count the number of votes for each of the ratings. Next, please. And then this data is collected centrally. The executive office, that's Pete and myself, at the moment are analyzing the quantitative data and creating charts for the countries to see how they did. And then we also provide them with the text responses that they can then analyze as they try to understand what the ratings mean. And then each country is expected to create do its own analysis, create its own summary, and to create ultimately an implementation plan to strengthen areas of weakness, as well as to share areas where they are doing better, and that they can then share those with other countries, so we can all become stronger and better over time. And then they'll have so the final output would be kind of a PowerPoint slide deck and the action plan that then is worked on over the next year, or depending on what the appropriate time frame is. Thank you. Next slide. So I'll read these through to you, but these are the 24 statements that we are using in our survey. We've tried to minimize the words, have as few words as possible, make the statements as simple as possible, but also as meaningful as possible. And to not combine two things into one statement so that at the end we're not sure what people are actually rating. That's why we've tried to make them as simple as possible. We've also created the surveys so that one can use a partner. So if we're working with a partner and the partner wants to run the survey, at the beginning one can, the enumerator can enter in, is it MEDA or a partner? If it's a partner, they would write in the name of that partner, and every statement would then have the name of the partner rather than MEDA as the enumerator reads out the statements. So let us, I'll just read through these. So MEDA responds to the most urgent needs of your community. MEDA helps the people who need it most. We look for the most vulnerable. We've seen that one. MEDA provides help at the right time, gives you hope for a better future, and helps you to be better prepared for future challenges. Next slide. And then, so this next group of questions or statements rather is around how the help is provided. For the first one was about the help that's provided. Now this is about how the help is provided. And the first one is, may our staff treat you and others in need with the highest respect. May our staff sincerely care about you and want to help. May our staff have the skills and expertise to help you, and community members feel safe while receiving help from MEDAIR. Next slide. This group is about involvement, information, and responsiveness. So this is around commitments 3 and 4. MEDAIR uses the knowledge and skills of people in your community to plan and implement projects. MEDAIR informs you of our plans. MEDAIR informs you of the progress of our work. MEDAIR informs you about MEDAIR and the help we give. MEDAIR informs you about the expected behavior of our staff. So really getting into some detail here about how we're communicating with people in need. What are the things that we need to tell them? These are the types of things that the CHS asks us to share with people in need whom we're serving. And so here we are, we're asking them, have we informed you? Have we told you about this? Have we told you about that? Have you heard from us these things? Next. So the next group is specifically about commitment 5, feedback and response. We struggled about how to phrase this best, but this, I think what we came up with is a great way to do it. It says, if you have a complaint to make or other feedback to give out about MEDAIR services or about our staff, you would know how to share it with us. So we didn't ask people, do you know our feedback feedback mechanism, etc. We really care about, would you know how to give a response to us? And then the next one, MEDAIR welcomes and responds well when you complain or give other feedback about our work or staff. And as you'll see later, this second question, especially not everyone knows how to answer this one. So because maybe they haven't given feedback. So we would expect, and we're glad to see that people are saying, I don't know the answer to this question. Next slide, please. So moving on to commitment 6, about coordination, and 6 and 7. MEDAIR coordinates and works well with other organizations who also provide assistance, and MEDAIR improves its assistance over time. So there's 6 and 7. Again, often people will say they don't know, but that's also fine. Those who do know, they give a rating, and we count those ratings in the average. Next. And I think the last group of ratings is around our integrity, around our independence, the humanitarian principles. So MEDAIR does what it promises to do. MEDAIR is honest and fair. There's commitment 9. It acts to prevent or stop abuse and corruption by our staff. And then the humanitarian principles. MEDAIR helps people in need regardless of their tribe, nationality, religion, etc. MEDAIR does not take sides in conflicts. MEDAIR is not influenced by political, economic, or military objectives. So you can see in all these slides here, in all these statements, we've really captured all of the 9 CHS commitments, as well as the humanitarian principles, as well as a couple things that uniquely reflect MEDAIR values and how we want to do our work and conduct ourselves. Next. So I'm going to hand it over now to Pete. Pete will share with you a couple brief slides on how we, the analysis for this year's, one of this year's countries, Yemen. So over to you, Pete.
Thanks, Andrew. Hello all, and good morning, good afternoon. So as Andrew mentioned, in 2022, the People in Need survey was conducted in Afghanistan, South Sudan, and Yemen. And here are some brief results from our findings and the responses we got from Yemen. So just 4 quick charts here on this slide, and the next one as well, another 4. So here we have the count by men and women per base. In Yemen, MEDAIR operates in 2 places, in Aden and Al-Dahali, and the count by delivery type per base. Now the delivery type, here you see that it was exclusively direct direct aid. Other types of delivery type are cash, and perhaps that could be a delivery of aid through a partner. But here you see that it was the delivery type was direct for all of our responses. It should be noted that in Yemen we had 120 responses to the People in Need survey. And here, count by sector per base. There's three that you can see quite easily: health, nutrition, and wash. You'll see on the next slides that shelter and infrastructure was also registered, probably by 1 or 2 responses, and then other you can see in the second base here. And count by collection type per base. So Andrew mentioned the types of collection types we have: household visits, key informant interviews, focus group discussions. Interestingly, in Yemen, due to COVID-19 guidance from the government, and also due to issues of security, the Yemen team had to conduct all people in need survey gathering through household visits. Next slide. And here on this slide, we have average ratings. So you can see, you just notice on the far left of the chart, we have a scale 1 through 5, and the average rating broken down by men and women. In the top right corner, average rating by delivery type, the average rating by sector per base. There you see the shelter and infrastructure shows up, and that the average ratings in Aden were slightly higher than in Al Dahale, and the average rating by collection type per base. So that captures again the household visits and breaks down the average rating by base, by collection type. Next slide. In this slide, we have the statements, the 24 statements that Andrew just introduced you to, and how they align with different CHS commitments. And you can see the average rating by commitment within Yemen, from CHS 1 through CHS 9 and the CHS humanitarian principles. And the next slide. So some interesting points here about the count of ratings for all statements. You see all 24 statements here. And green, the darker green being strongly agree, the lighter green being agree, then the neutral, yellow, goldenrodish there, disagree, and red being strongly disagree. So of course we can pay attention to the strongly disagrees that show up here in our count for all ratings. And also the strong presence of don't know in this graph here for several comments, for several statements, 1 or 2 of which exceed or almost exceed 50%. So we have to take a look at, why so many people are indicating that they don't have the information to provide a response to that statement. So certainly something that we can look at as it relates to Afghanistan and South Sudan for 2022 as well. Consider the statement, was it phrased correctly? Is this something that we would anticipate a high don't know response rate to? All things that are part of our analysis at this point, now that the survey has concluded. Next slide. Now, as mentioned, also in 2021, the countries that conducted the survey included Lebanon. And here's just a snapshot at some of their findings that they scored very high in providing help to the most vulnerable people in need and on time, that the help assistance was provided respectfully and the staff was acted in a professional manner, and also that there was a clear indication that MedAir staff acted with integrity and independence in our contacts with the communities that we serve. Also, we captured the lowest scores here, those related to coordination and to internal learning from MedAir and how we acted upon that to alter, adjust how we delivered aid. Next slide. And a further country from 2021 was Madagascar. We were able to ask for some feedback from the 2021 countries in the last several days to capture some of their feedback a year out from when they took the survey. And they were able to provide us, of course, where they found that they scored strongly and in areas where they indicated where the people that we serve indicated that we needed to address some improvements. So when it comes to weaker ratings, those we serve were not aware of all the disaster relief reduction activities going on and perceived that the aid was not adequate to the need. Also, some concerns regarding Med-Air being ethical and fair were raised due to differential allowances for volunteers and not having enough Med-Air visibility vests for everyone. And as I mentioned earlier, we could see that there was some significant I don't know ratings for some of the statements. So at that point, I'm going to turn it back to Andrew. We'll conclude, and then we'll get to some Q&A.
Great. Thanks, Pete. Yeah, so just thanks for the questions. Go ahead and keep typing them in. We'll take a look at them in just a moment. Just wanted to wrap up here with this last slide. The key points from the survey is that we are asking people in need how they feel that we align to the CHS and our values. Obviously, we don't use the word CHS, but we use the commitments of the CHS to phrase the statements. We've created and conducted a survey. We analyze the findings, the country programs, develop and implement action plans to address the areas of weakness, and also we ask them to share their strengths. This really does strengthen our understanding of and alignment to the CHS and our values, because it forces us to say, well, what can we do to get stronger ratings on this? But and it is part of how we learn and how do we improve our work for greater impact. So it's a continual process of continuous improvement, and this is one of the ways that we engage with communities together with other surveys and the feedback that we receive from the communities that we're serving. Next slide. Okay, so time for questions.
So I'll take Phillips. I'll take Phillips here first. It was the first question. It's a tough one. And we have about just under 10 minutes to tackle some of these. So Phillips' first question, do you think that these 24 statements might be a useful input to the CHS revision to make it simpler and more accessible? And if Andrew's ready to be put on the spot, I will address that question to him.
Well, honestly, I haven't thought about it that way, but surely I think it is a helpful summary of the things that the people in need whom we're serving should know, or ways in which they can evaluate us and our work. So I know there's the plain English versions of the CHS, but certainly it's a good point. We will provide this as input to the CHS revision. Thanks for making that suggestion, Philip.
And a further question from him. Also curious to hear if you included any open-ended questions beyond assessing Med-Air's programs to hear how people might describe accountability in their own words. Yeah, so as you can see, everything that we've asked them, you can see here. By the way, one thing I didn't mention, which is worth mentioning, that at the very beginning, we do, in addition to the data protection and confidentiality, we also are very clear to tell them that this will not affect the support that they receive or might receive. It won't get them more or less, so they should not worry about. And it also that it is anonymous, that they don't have to worry if they say something negative, it might negatively impact the result, what we give them. In fact, we are glad to hear negative comments and feedback so that we can improve. So the only effect that it should have is that our support and assistance for them will be better over time.
So yeah, we do address that, but no, we at the very end we do have the last question, which is there anything else you would like us to know or you would like to tell us? So we do give them that opportunity, but we haven't specifically asked them about what does accountability mean to you. So the survey is done on ODK. It's very flexible. One can easily add or take away or modify questions. So that may be something that someone would like to do.
A further question from Fernanda. Any recommendations from communities captured of what can be better?
Yes. So there are, unfortunately, I don't have them in my head right now, but as you saw, there were a couple negative feedback points, and there have been, Pete, I don't know if you have any in your head.
Yeah, as for 2022, we haven't had a chance to look at the text responses, but of course that's oftentimes where, we also conduct an employee value survey, and it's going to be in the text responses, or in this case, of the people in need survey, the notes taken by the enumerator or a co-enumerator, someone assisting in the process. And I haven't had a chance to review the feedback provided, but what's most important is, of course, that feedback gets in the hands of the country teams for this year for South Sudan, Afghanistan, and Yemen, so that they can evaluate it, they can discuss it amongst their team and respond as needed. And so, of course, you can see things in the ratings that bolster the text responses and vice versa. But as for a system for capturing those recommendations, most importantly, that it ends up in the hands of the country team who can act upon it.
Yeah, but the simple answer is yes. We do get negative critiques and things that they want to see done differently, and reasons for low ratings. We do get those, and those form then part of the analysis that each country is asked to do. How do we? Sorry, let me jump to the next one the next two while we're here about reducing bias. So, in the survey that we did in Madagascar last year was done by an outside organization. So that is something that, again, this is a flexible tool. It can be used by whoever we grant access to the survey. So definitely that can be done, and as one way of minimizing the bias. Carly, I'll take your question quickly. I've looked at it in the past, and it's not that strongly correlated. As a simple example, that MEDAIR coordinates with other NGOs and so forth. It's just something that the people that we're interviewing oftentimes just don't know about all the things that we're doing. And so, even though it is something that we do a lot, it's something that we have gotten a high rating in our CHS certification audits. It's not something that communities are aware of, and so we don't get as high a rating as we might there. So, but it does inform us. Again, of what the community perceptions are, and that's a very important thing for us to work with.
Two quick additional points regarding who conducts the survey and bias. One moment here. You probably all just got to pop up just like I did. One is that in the 2021 survey was conducted among other countries in Bangladesh, and Bangladesh realized that they had the funds available to hire enumerators, and so they did so. And that of course has sort of knock-on effects, positive, potentially negative effects, because the discussion may not be as rich because the enumerator is not able to lead the discussion in a certain way. Perhaps the positive effect could be that people feel more comfortable sharing their more honest thoughts about where MEDAIR falls short in their assessment. Secondly, is that this year around we had quite a lot of conversations with meal people from MEDAIR, experts in this field, who really addressed the focus group discussion as a source of potential bias, where people may be sort of just to go along and maybe answer in the same way as a more authoritative voice in the group, or someone who sort of the sense of not wanting to rock the boat. So we had to look at how we assessed focus group discussion responses and thought about sort of weighting or unweighting responses that so that that a focus group discussion perhaps didn't have an outsized effect on the overall ratings. So if there's time for one more question.
I don't think we have time.
Yeah.
So we need to quit, but the short answer is, are we going to share this? Yes, we would like to share this through the CHS Alliance so that others can take this and adapt it for themselves. And thanks everyone for your attention, and glad to entertain any further questions directly with us. Thanks.